Imagine this. Your elderly parent or grandparent has been living with hepatitis C for years. Maybe their liver tests have been up and down, but things seemed mostly stable. Then, seemingly out of nowhere, they suffer a stroke. You might wonder, could their hepatitis C have played a role? Is there a hidden connection between chronic liver disease and strokes? And what can you do to protect your loved one? If you've ever asked these questions, you're not alone. Today, we're going to talk about the surprising link between hepatitis C and stroke risk in seniors. We'll explore how hepatitis C affects blood vessels and the brain, what research shows about the connection, and, most importantly, what steps you can take to lower stroke risk if someone you love is living with hepatitis C. Let's dive in. What is hepatitis C and how does it affect seniors? First, let's start with a clear understanding of what hepatitis C actually is. Hepatitis C is a viral infection that primarily affects the liver. The virus spreads through blood and over time it can cause chronic liver inflammation, scarring of the liver called fibrosis or cirrhosis, liver failure or cancer in severe cases. For many people, hepatitis C infection doesn't cause obvious symptoms for years, even decades. That's why it's sometimes called a silent disease. In seniors, hepatitis C can be even more challenging because the immune system naturally weakens with age. Long-term liver damage may already be present. Other health problems like diabetes, heart disease, or high blood pressure often occur at the same time. These overlapping issues create a perfect storm of risks that can impact not just the liver, but the heart and brain as well. How could hepatitis C contribute to a stroke? Let's talk about the mechanisms, the how behind this connection. Researchers have discovered several ways chronic hepatitis C may increase stroke risk. 1. Chronic inflammation. Hepatitis C keeps the immune system activated all the time. This constant inflammation doesn't just affect the liver, it can damage blood vessels throughout the body. Inflamed blood vessels are more likely to develop plaque atherosclerosis, narrow or stiffen, become prone to clots. All of these changes raise the risk of stroke. 2. Changes in blood clotting. The liver produces proteins that help blood clot properly. When the liver is damaged by chronic hepatitis C, clotting can become unpredictable. Some people develop increased bleeding risk. Others develop excess clotting, which can trigger strokes. 3. Insulin resistance and diabetes. Hepatitis C is linked to insulin resistance, which means the body doesn't respond well to insulin. Over time, this can lead to type 2 diabetes, which significantly raises stroke risk. 4. Heart disease and atherosclerosis. Several studies have shown that people with chronic hepatitis C have higher rates of heart disease, including coronary artery disease, peripheral artery disease. Since the same arteries supply the brain, this increases the likelihood of ischemic stroke. 5. Cryoglobulinemia. This is a condition where abnormal proteins in the blood clump together and block small blood vessels. Cryoglobulinemia is more common in hepatitis C patients and can affect circulation in the brain. Bottom line, while hepatitis C is mainly a liver disease, its impact reaches far beyond the liver, including increasing the risk of stroke. What does the research say? If you're wondering whether this connection is just a theory, here's what studies have shown. Small Blue Diamond, a large 2012 study published in the journal Stroke, looked at over 22,000 people and found that hepatitis C infection was associated with a 27% higher risk of stroke. Small Blue Diamond. Other studies have confirmed this link, especially in older adults with long-standing hepatitis C. Small Blue Diamond. The risk appears to be higher in people with advanced liver fibrosis or cirrhosis. While researchers are still learning exactly why this happens, the evidence is clear. Chronic hepatitis C can contribute to stroke risk. What are the signs of stroke in seniors? One of the scariest parts of stroke is that time is everything. Recognizing symptoms early can save a life or preserve brain function. Remember the acronym FAST. F. Face drooping. Ask them to smile. Does one side droop? Arm weakness. Can they raise both arms? Does one drift down? S. Speech difficulty. Is speech slurred or hard to understand? T. Time to call emergency services. Other possible symptoms include sudden vision loss, severe headache, confusion or trouble understanding speech, loss of balance or coordination. If you see these signs, call 911 immediately. Should you treat hepatitis C in seniors? For many years, hepatitis C treatment was difficult with long regimens and severe side effects. But today, new antiviral medications called direct-acting antivirals can cure hepatitis C in over 95% of cases. Even in seniors, treatment is often recommended because it can stop further liver damage. It may lower the risk of stroke and heart disease. It reduces inflammation throughout the body. Treatment decisions depend on age and overall health, liver function, other medical conditions, personal preferences. If your loved one hasn't been evaluated for treatment recently, ask the doctor whether new options are available. How to reduce stroke risk in elderly people with hepatitis C. Even if hepatitis C is cured or controlled, other stroke risks remain. Here are practical steps you can take. 1. Control blood pressure. High blood pressure is the #1 risk factor for stroke. Target readings are usually below 130/80, but your doctor can recommend what's best. 2. Manage diabetes and blood sugar. If your loved one has diabetes or pre-diabetes, work with their healthcare team to keep blood sugar stable. 3. Lower cholesterol. A healthy diet, exercise, and sometimes medications help reduce plaque buildup in arteries. 4. Encourage physical activity. Even light movement like walking or chair exercises improves circulation. 5. Avoid smoking. Tobacco damages blood vessels and accelerates atherosclerosis. 6. Eat a heart-healthy diet. Focus on fruits and vegetables, whole grains, lean proteins, healthy fats like olive oil and nuts. Limit processed foods and excess salt. 7. Take medications as prescribed. This includes blood pressure pills, blood thinners if recommended, statins for cholesterol, diabetes medications. 8. Keep vaccinations up to date. Flu and pneumonia infections can strain the heart and increase stroke risk. 9. Stay hydrated. Dehydration can thicken the blood and trigger clots. 10. Schedule regular checkups. Routine visits help catch problems early. Emotional and practical support for families. Caring for an elderly loved one with hepatitis C and stroke risk can feel overwhelming. Remember, be patient. Fatigue and confusion are common with chronic illness. Educate yourself. Knowledge reduces fear. Build a support network. Family, friends, and community resources can lighten the load. Practice self-care. Your health matters too. When to seek immediate medical attention. Always call emergency services if your loved one has sudden weakness or numbness, difficulty speaking, severe headache, vision loss, dizziness or loss of balance. Do not wait, every minute counts. A message of hope. It's easy to feel discouraged when chronic illnesses stack up. But here's the truth. Hepatitis C is treatable and often curable. Stroke risk can be reduced with proactive care. Every small choice, healthy meals, taking medications, regular checkups, adds up to a longer, better quality of life. You are not alone on this journey. If this video helped you understand the connection between hepatitis C and stroke risk, please subscribe to our channel for more guides on senior health and caregiving. And if you know someone caring for an elderly loved one, share this video with them. Together, we can make sure every family has the knowledge and support they need. Thank you for watching. Stay informed, stay compassionate, and remember, every step you take is an act of love.